COVID-19 is exposing health inequalities that many of us experience in our lives, such as
diabetes,
hypertension,
stroke,
dementia,
prostate cancer,
heart disease.
We work in a range of professions, some which involve working from the front line. These put us at risk. Some of these jobs are
shopkeepers,
taxi drivers,
bus drivers,
delivery drivers,
healthcare assistants,
doctors,
nurses,
care workers, in care homes and in the community.
Some of the contributing risk factors described by our people from our community are overcrowded homes, multi-generational homes, densely populated areas, poor health literacy, and fake news that prevents correct information getting to some people.
I believe in the African Caribbean, the African communities and the Asian communities, I believe there's a lot of distrust towards researchers because of the perceived or actual exploitation that happens within communities when it comes to research. There's a lot of consultation, there's a lot of asking questions, but then there's never any follow-up. There's never any, well, we've taken the information and this is what we put in place. It's always, thanks for your help and see you later. And that's usually the last we hear of it. So I feel like there's a big disconnect and a distrust because of the lack of action that we've seen to do with previous research studies and research groups. I feel as though a great deal of this distrust stems from the mistreatment of West African communities, Indian communities, whilst they're so, I mean, especially if you look at the COVID thing, there was a huge push at one point. I think there was an Italian and a French scientist were saying, well, Africa's a perfect place for us to practice this vaccine because, you know, the high transmission rate and But it's like, hold up though, people aren't dying on that continent at the same rate that they're dying in Europe. You should probably try the vaccine where it's needed first. So things like that make us put our backs up against the wall. Why would you be so strongly suggesting that you try a vaccine in a country that's probably got less than 15 cases, rather than the country that's had over 5, 6, 7, 8, 9,000 deaths? Those things, those inequality in attitude towards our life and our value of our life definitely makes us feel uneasy, and I think that's a huge barrier. I think it's a huge barrier for Black and minority ethnic communities to overcome.
Some researchers have parachuted into Black and minority ethnic communities and have conducted various research and disappeared without giving feedback. This leads to a lack of trust.
Yeah, I think there's a lack of trust amongst us because of years of discrimination, racism, and all those factors that has culminated in us not feeling that we're part of mainstream society and therefore we're reluctant to participate in research. Black people have had issues in this country since I came here in 1959.
There is a lack of diversity from BME communities in research teams, including at the leadership level.
Stop ticking boxes. There is a real need for positive changes now in this COVID-19 crisis.
From the get-go, we need to engage with communities to develop relationships based on trust and mutual respect, not transactional ones.
from the get-go, we want parity. We want to be at the table with you, at the beginning of research, so that we can work in collaboration and partnership with you.
From the get-go, culturally competent researchers, including those from diverse BME communities, should be employed.
Don't reinvent the wheel. Look at past studies that maybe didn't have the follow-up they deserve, and look at how those findings can help support how you can better support BME communities today.
From the get-go, work with organizations and people that are trusted, and these are
community and voluntary organizations,
GPs,
The schools,
community workers and volunteers,
churches, mosques, temples, and gurdwaras.
You also need to keep the participants informed about what you're doing with their data during the study and after. inform participants how and when feedback on findings will be given.
Think about developing translational research that enables findings to be implemented in shorter timeframes.
Research organizations need to recruit BME staff that are reflective of the diversity of BME communities.
Undertake culturally appropriate prevention and self-management support for all BME communities in some of the health conditions that have been implicated in COVID-19. These include diabetes, heart disease, hypertension, asthma, and other chronic health conditions.
Research and produce the tools to support people, including those with poor health and social media literacy, to recognize and filter fake news.
I think we're at a point where it's quite important for us to look not just at the diaspora, but at how communities are being treated in the homelands, whether that be West Africa, East Africa, Asian, or the Caribbean. Look at how COVID is impacting Black and BME communities in the communities they exist within, because we'll see a disparity between the number of deaths within the Black community here in England or in the West and the number of deaths in continents that are just populated by Black people. There's a huge disparity, so I feel like we have to ponder the genetic argument against the socio-economic and cultural argument, because I feel like genetically there's not much different between me and my brothers in West Africa. Do you know what I mean? We're both the same, both melaninated, both have kinky hair, but I'm a lot more likely to die here than I am over there. So I feel like we have to look at the other factors, which socio-economic, prosperity, opportunities, things that actually concern the working class people in England as well. It doesn't matter what color you are, but being Black, it's compounded by the fact, especially when we look at home and see the effect that it's having there. So I think it's time for some research that looks at the diaspora as a whole, not just in isolation.
So it is important that all researches, including COVID-19 research, is conducted with and by members of the public, not to or about them.
The overriding message from the community members who have taken part in this video is engage with BME communities from the beginning of your research in a spirit of collaboration and partnership. And this collaboration must be based on a recognition and understanding of the historical and continuing experiences of racism and discrimination in wider society, including research practice. They want to see your commitment to ensure that you don't perpetuate these in your practice and relationships with BAME communities in COVID-19 research. How do you do that? You first need to ask whether your research leadership and team members are reflective and inclusive of the BAME communities you wish to engage. If it isn't, you need to address this. You also need to ensure that research teams are culturally competent, and there'll be further clarification on cultural competency later on in the video. They also spoke about researchers needing to avoid reinventing the wheel. One of the ways that you can do this is make use of the published research evidence, including grey literature, that has already been undertaken, and talk to the communities you wish to engage with to develop your understanding of their specific issues such as health literacy, stigma, and they can also help with recruitment strategies. This is so that you don't contribute to consultation and research fatigue. Develop and implement a community engagement programme that forms the cornerstone of your research plans. You can do this by working with organisations that are embedded in BAME communities, such as community and voluntary sector organisations and professional organisations such as GP surgeries and schools. You need to be committed to developing and resourcing long-term sustainable relationships with BAME communities at an organisational and individual level. This can help to prevent the hit and run approach that has been employed in the past. Be transparent about the way data is used and stored throughout the research and afterwards. Undertake feedback of your findings and future plans to both participants and the communities you have engaged with. Develop partnerships with commissioning bodies and health service providers so that you can build in the impact of your research from its inception. The aforementioned suggestions are by no means complete. Gaining a better and more fuller understanding of the issues involved is crucial, so please ensure COVID-19 research is conducted with and by members of the public, not to or about them.